listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 28. This is the start of the final and the third trimester. You can see a picture of what your baby looks like this week, read the transcript, and access the additional resources for week 28 at pregnancypodcast.com/week 28. Your baby that was the size of a cabbage last week is growing this week to the size of a large eggplant. They measure 14.9 inches or 37.9 centimeters, and they weigh about 2.7 pounds or 1.2 kilograms. By this week, your baby has reached its maximum fetal growth rate. Did you know that your baby might be dreaming? Scientists can detect rapid eye movement of babies in utero. Periods of REM sleep will actually increase as your baby grows. When your baby is awake, it can open and blink its eyes, and its vision is improving. A test that can be performed after 28 weeks is a fetal non-stress test. This can be recommended if your baby is not moving as frequently as usual, if there's any reason to suspect that the placenta is not functioning adequately, or if you're at high risk. This test involves attaching belts to your belly to measure fetal heart rate and contractions, and this test can indicate fetal distress or if your baby's not receiving enough oxygen because of placental or umbilical cord problems. At the start of the third trimester, prenatal appointments increase in frequency to every 2 weeks. Take advantage of those extra appointments to ask questions and get the answers you need to keep making excellent informed decisions for you and your baby. And take your partner with you. They're half of the equation, and it's a great opportunity for them to hear everything firsthand and ask any questions that they have. Your uterine tissue growth slows from this point forward. Your uterus will continue to stretch and become thin to accommodate your growing baby, and it's now moved to 3 inches above your navel. Your uterus can press against the tubes between your kidneys and bladder, which can slow urine flow. Also, the hormone progesterone makes it more difficult for your urinary system to flush bacteria out of the bladder. All of this means that you're more susceptible to urinary tract infections. According to the CDC, UTIs occur in about 8% of pregnant women. The American College of Obstetricians and Gynecologists recommends that if you're pregnant and you think you have a UTI, call your OBGYN right away because severe infections can cause problems for both you and your baby. So it's very important to treat UTIs early. You can learn about the symptoms of a UTI during pregnancy, testing, prevention, and treatment, as well as the evidence on home remedies in a pregnancy podcast episode at pregnancypodcast.com/UTI. During pregnancy, many physical changes can contribute to swelling. You have 45% more blood and fluids in your body. Your uterus is putting pressure on the blood vessels in your pelvis and legs. Plus, you have elevated hormones during pregnancy that can make the walls of your veins softer, which makes them not work as effectively. Normal swelling, or edema, can be caused by the accumulation of fluids in tissue. Swelling is common in legs and feet and can also show up in your hands. And you may notice this if your rings are not fitting anymore. Numbness, tingling, or your legs and feet being achy can accompany this edema. The good news if you're dealing with this is that you can make easy adjustments to help prevent and to reduce swelling during pregnancy. For more information and evidence-based treatments, see the Pregnancy Podcast episode at pregnancypodcast.com/swelling. One more symptom that may be coming up this trimester is back pain. Pregnancy hormones relax the joints between the bones in your pelvic area. That can be tough on your back and your hips. Plus, you're carrying around extra weight, which can put additional strain on your back. You want to make sure that you're sitting on chairs with good support, especially if you're at a desk all day. You can use a pregnancy support pillow when you're sitting or lying down. You want to opt for shoes with good arch support or use insoles to help protect your feet from issues that can come up. You can try a heating pad or an ice pack for comfort. A prenatal massage may be helpful, or ask your partner for a massage. And if you're suffering from back pain that you cannot alleviate, please bring it up with your doctor or midwife. For more information on everything that you can expect in the third trimester, visit pregnancypodcast.com/third trimester. A tip for dads and partners: give your significant other a massage because it's likely that they're going to be dealing with some form of back pain. If you don't feel up for giving them a massage, you could offer to run a bath so they can relax and get some relief, or spring for a gift certificate to get a professional prenatal massage. Thank you for tuning in to the 40 Weeks podcast. You can see the full transcript and all of the resources for this episode at pregnancypodcast.com/week28. Next week, your baby keeps putting on weight and is starting to plump up. Until then, I wish you the very best in your pregnancy journey.